for those parents or
About
caregivers
9,000
who
children
may
across
not
the
have
18
the
local government
opportunity to
areas of Cross
visit
River
the health
State are set to be
facilities,
vaccinated
please take
against
this
killer
and visit
diseases
them
which target children.
wherever they are. All we are looking for in
The
this
exercise will
first
be
round
carried out during
of
a house-to-house visit in
2022
schools, marketplaces, and designated health posts in the state.
Has been showcased, and
According to the DG, mothers in Cross River State are now keen to participate in a week-long activity that complements routine health services with unlimited packages proven to boost their own health and those of their babies. She also calls for improved feeding habits of children under 5 years of age and women, especially during pregnancy, to support the development of the fetus and maintain their health as well.
Right from when a child is conceived, we believe that the health of that child is key, and that's why we're really focusing on pregnant women and within the children within the ages of 0 to 5 years, because at that stage they don't really have very strong immunity, so you must build their immunity at such tender age to ensure that you prepare them for the future.
Are going to be distributed.
The Permanent Secretary of the Cross River State Primary Healthcare Development Agency, Emmanuel Eke, encourages pregnant women to take advantage of this opportunity.
Please take advantage of this notable program that has been put in place by government via the agency. Cross River encourages and will continue to encourage and support partners who are willing to partner with Cross River State.
Who may not have the opportunity.
The host community
to visit
expresses
the health
gratitude for the
facilities,
gesture
please
by the state
take this
government.
service.
We appreciate you, ma, for choosing Diamond to showcase what the health is about for the women and the children. We appreciate it so much.
The state government has assured that all 900,000 children targeted will be well attended to, especially those in the rural and hard-to-reach communities, as they call on all parents and caregivers to take advantage of the opportunity.
All right, let's get more on this. Our guest, the Director General of the Cross River State Primary Healthcare Development Agency, Dr. Janet Ekpeyong, joins us on the program. It's great to have you on News Across Nigeria.
Thank you very much for having me. Good afternoon.
Good afternoon. Now, tell us, how do you expect to cover almost 1 million children in this phase of the Maternal, Newborn and Child Health Week from the reports that we just watched?
Okay, so the Maternal, Newborn and Child Health Week is one of those high-impact interventions that has been deliberately introduced by federal government and partners, as well as state governments, to ensure that pregnant women and children under 5 can be touched, in the sense that if they have missed out from the routine services they're supposed to have, this serves an opportunity for them to receive those services. And yes, we have over 900,000 children in Cross River State within the ages of 0 to 5 years. And based on the past, campaigns we've had, that has provided such data. And for us to ensure that those children are covered, this particular intervention focuses on this facility-based. We also have health workers going from house to house. We also have some temporary sites being, erected just to ensure that those children are not missed. And even schools are being visited, worship centers, everywhere where these children will be seen. Even the very hard-to-reach areas also, the health workers are ensuring to get there, have to cross water, they have to go climb mountains because of how the difficult terrain in Cross River State. We know it's usually a huge challenge. However, over the past years, we've been able to achieve that, and this particular campaign is not different. So we are sure to even surpass the target. And even for the pregnant women, we are sure that as many of them that may have missed out on the routine antenatal care services, this serves as an opportunity for them to receive that care, because they will receive all their folic acid, HIV testing, malaria testing, and other services, of course, that they're supposed to have during this period.
All right, Director General, tell us what actually is the rate of success of previous, editions of vaccinations against childhood diseases, and considering the fact that, like you touched on, the wide reach, how to make the health workers get to places, that have a difficult terrain. What's the success rate of previous editions?
Okay, so I'll just start with the outbreak response campaign we just concluded about 2 weeks ago. I'm interested to know that Cross River State hit over 90% in that particular intervention, which means children within the ages of 0 to 5 years, were touched. And for us, our strategy is just simple. At the health facilities, we have health workers who are stationed there to ensure that mothers who, due to their busy schedule or one way or the other might, when they have time, can just take their babies to the health facilities or their children to the health facilities and ensure that the children are vaccinated or receive their vitamin A supplementation and, of course, their deworming tablet. And, of course, even children that are in schools. And that's why we are very grateful for the Ministry of Education, who have been very supportive in this drive, and as well as so many other stakeholders. So health workers visit the schools where we have a huge number of these children, and those children within the age range are also vaccinated. And as well as worship centers, anywhere we know that we can get children. So that helps us to actually hit our target and even surpass it. So it's always been a huge success for us in Cross River State, and that has been because of the dedication of the health workers and the commitment of His Excellency Senator Professor Ben Ayade. The health workers get to move from house to house, and of course the responsiveness of Cross Riverians, because caregivers, parents, they've always been very responsive, opening their doors, allowing health workers to ensure that their children are vaccinated. That has contributed immensely to ensuring that we do not record any, vaccine-preventable diseases in Cross River State. So for us, it's always been a huge success, and I must really commend their resilience, especially the health workers. They've had to go, cross water. They've had to go to climb mountains and go all sorts, all out to ensure that even those in the very hard to reach areas are also covered during such campaigns. So we've always actually surpassed our targeted figures, and I'm very certain that even this one, while we wait to get the final numbers of children covered, I'm very certain that we'll still surpass the numbers.
All right, talk to us about the mortality rate, Director General. What's been the success rate, as regards pregnant women and, of course, newborn babies?
Oh, so, because of the COVID pandemic, that had actually affected a lot of patronage of health facilities. Pregnant women, children, caregivers taking their children to health facilities, especially when we had to, stay at home. Of course, that really dropped the rate of facility visits. Because of that, we even had to deliberately set up outreach centers, just to ensure that our people can have access to healthcare services. And I'm glad that once we were able to have the COVID virus under control, and of course continuous advocacy and education, and of course sensitization, there's been increased patronage of health facilities. Because of the fact that people had to stay at home, that also led to patronage of TBAs and deliveries at home. And I must tell you, the rate has been really, really high up there. At least in Nigeria right now, we know about mortality rates about 814, per 100,000 live births. So for now, based on the data we have, a lot of pregnant women have been coming to the health facilities, to not just for antenatal care services, but to also deliver their babies. And that has really helped tremendously, because the number of deaths that we've been recording in the past, because most of them only come in when they already developed complications, maybe difficulty in delivery because of where they may have visited before arriving health facilities. But such has really gone down drastically, and I must really commend them because that has also helped us, and we're hoping that they will continue to patronize health facilities and, of course, ensure that they come for their ANC services and get them screened to ensure that whatever infection that may also lead to maternal mortality could also be, managed, would be it HIV, be it malaria, or they'll be tested, and of course the right treatment initiated, and of course ensure that they are also placed on the vitamins and folic acid and other supplements they are supposed to be taking. We believe that with this continuous patronage and, of course, with the basic services available for them, because right now, at least in Cross River State, pregnant women are being managed for free because of the basic healthcare provision fund that is available, as well as the health insurance services that are available. So that makes it a lot easier. And, of course, we believe that the fact that they know they don't have to pay for such services, that would also help them tremendously.
All right, interesting there. We thank you so much, Director General of the Cross River State Primary Healthcare Development Agency, Dr. Janet Ekpeyong. We thank you for your thoughts on the program News Across Nigeria.